My name's Kevin Haggerty. I'm a Western GP and the urgent care lead for North Somerset CCG. And on the platform with me is Jenny Winslade, who's the Director of Nursing at South West Ambulance Service, and Dominic Morgan, who's the urgent care lead for Baines CCG. And we're here, and you're all here, really for the same reason. All of our systems at the moment are in trouble. They're running hot, and that heat is being generated by rising demand. And that demand is rising really above demographic growth, and we're facing it with fixed resources. It's a crisis, and that crisis hit the newspapers several years ago, and as a result of that, the urgent and emergency care review was begun, and we're all part of that process. This winter that's just gone demonstrates really that things aren't getting any better. Demand rose to record levels across our systems. So we've got to get a grip, and we've got to really get a grip of demand. That's the thing we've got to get hold of. And if you look at demand in service industries, you see that something between 40 and 60% of that demand is what you could term failure demand. That's demand that's being generated by the organisation's inability to meet their customers' needs at the first opportunity. And the NHS is no different. And that's good news in a way, because that means a large part of the demand that we're really struggling with is failure demand, and we can do something about that. So, what do we do about it? What we have to do about it is address it by improving quality of care. And if you look at the urgent care review, it's a great read as a clinician. It's all about improving the quality of care we provide. And we should define quality from a patient perspective. It's about meeting my needs as soon as possible, as close to my home as possible. That's how we should define quality. And what we have to do across our systems is improve quality. And if you look at the urgent and emergency care review, it talks about getting it right first time, being efficient and effective, being simple, consistent and local. All those things we need to do. And if we can do those things, then we'll start to reduce the amount of failure demand in our systems. And we'll free up our clinical teams to work more efficiently, and we'll create sustainable systems with good outcomes. So how do we do that? Well, in a sense, when we look at the urgent and emergency care review, there are no surprises there. I've been working in urgent care since 2008. I've been trying to do these things for many, many years, and I'm sure you all have as well. What we struggle with isn't knowing what to do, it's to work out how to do it. It's implementation that the NHS and the social care system is so poor at doing. And if I think of my particular area in North Somerset, I can see some really good things that are happening there. We've connected up our records across social care and hospital care and primary care. We've got good systems in place now for pharmacists to take emergency prescription requests. Good things there, and there's good things in lots of other places. But those things have often taken an awful lot of time to deliver, and we're wasting them in some sense because we're not pushing them out across the whole system. Now, what our bid is about doing is trying to do just that. Is to crack that implementation nut, if you like, to deliver improvement, quality improvement at scale and at pace. And we need, in a sense, a nutcracker to do that. And I think we've come up with that with what Baines have designed, which is a quality improvement tool. It's called a quality first approach. And it allows us to test and challenge the way we do things to make sure that we deliver high quality care every time. And what I'd like to do now is just to hand over to Jenny to talk about the perspective of that from the Ambulance Trust. Now, we are a very complex trust, lots of organisations involved with it, 3 million patients in our network. But what unifies us all is in fact the ambulance, and that in a sense is our operational framework which we can build improvement around. So I'll hand you over to Jenny.
Thank you, Kevin. I won't keep you for very long, but as Kevin says, we're a single ambulance trust across the whole of the South West, from Gloucestershire down to Cornwall and across to Wiltshire. And we believe we have a central role in the emergency and urgent care system. We're already well supported by our commissioners to focus on right care, an initiative that's been commissioned through us, but enables our paramedics to make the right decisions in the home. We already perform the best for non-conveyance in the country. But one of the things we have been doing, we have been doing more recently is a pilot, I do apologise, a pilot on something called Dispatch on Disposition. This enables us to take more time to clinically triage patients to make sure they get the right resource. Now, we know from the early findings that's already improving quality, but it's also improving performance across the urgent and emergency care system. That puts us, we're in a national pilot with London, so we already are a vanguard, both nationally and internationally, around how we focus on clinical systems, clinical support for paramedics, and how we work more effectively across the whole of the urgent care network. In addition, we believe we can be an honest broker in the system. We obviously see the totality of the pre-hospital environment. We have a huge amount of data, but we're also a critical partner to those networks and how they develop, but also how we get to the point of providing the right care to the right person in the right place. Now, I know a lot of people talk about that, but I think we have real demonstration of that in our work with local commissioners around right care, but also dispatch on disposition. And we can create single points of clinical support to enable clinicians to make the right decision first time. Thank you.
Thank you very much.